Hello, everybody. Welcome. I'll just give it a couple minutes for everybody to arrive, and then we'll get going in just a few. Hello. Good. I'm glad everybody can hear me okay. Hi, Michelle. Hi, Marianne. Hi, Dinah. It's good to see you all here. It's a lovely sunny day. I can see out my window. It's a great day and a cold, so it's a good day to be inside too. Alrighty. Okay, so we're at 2. I guess we'll get started. This is being recorded, just to let everybody know. So you can always refer back to it if you find anything comes to mind after the fact. And I believe you will all get a version of this, so you can. Keep in mind, this is our first webinar, which I hope will be one in a series of many to help everybody navigate their way through this journey that is very unique. So thank you so much for joining us today for the Understanding Post-Surgical Garments webinar, our first one. In case you don't know, I am Vanessa Freeman. I am the owner and certified fitter for Pink Ribbon Boutique. We are located in Markham, Ontario. Not too sure if anybody is from Markham or in and around Ontario or even beyond. We're kind of smack in the middle. Also, we are online, so we can always support people, regardless of where you are in Ontario or in the country or beyond. I'll give you a little kind of intro about me if you're not familiar. I am 46, owner of Pink Ribbon Boutique. I have 3 lovely children, and in 2016, I found out that I was a BRCA2. I had a BRCA mutation. So after much thought and consideration, I did decide to have a prophylactic double mastectomy back in 2017. So I come to you with firsthand knowledge of really why, this community is important, why understanding the garments are important, where they fit in this journey. When I was going through this, I didn't have this information, and I did find that it was really challenging to navigate, where I should be, what I should do. So hopefully we'll find some clarity here within this webinar. I've been 10 years past my surgery. I've had multiple surgeries, multiple different kind of surgeries, reconstruction, under the muscle. I had the implants removed because of a medical recall, and then chose to do a DF flap reconstruction. So I say I've been collecting surgeries, but I've also been collecting knowledge, and I really think that it's important to give back and help everybody understand this, and everybody's journey is very unique. And so I'm just grateful that I have the opportunity to share this information with everybody and do what I do every day, which I love. So if we haven't met in person, I always invite you to come by the shop if it is possible, book a virtual fitting. I have a fantastic team on board at Pink Ribbon, and we are definitely always available to help with any questions or guide you through anything that may crop up. So today, what we're going to cover is why specialized post-surgical garments really matter. There's definitely a lot of discussion surrounding this and a lot of misinformation. So I think it's a great opportunity for us to dive in and chat about it. A note also is if anything that we do talk about today, or if you have questions that you're unable to get answered, please do feel free to message me at any time. I left my email address on the little sticky area in the chat window. It's vanessa@pinkribbonboutique.ca. You can also visit us online at pinkribbonboutique.ca anytime. And also, if we have a bit of time at the end of the webinar, I'm going to open it up to questions. So if you have any questions, I'll do my very best to answer. And you know what, if I don't know, I'm always looking for information. So if I don't know, I will definitely get back to you. This is a space that's constantly evolving. So we definitely want to make sure that if we don't know, we're looking and trying to find the answer for you. So beyond actually the post-surgical garments themselves is really how to choose which one is right for you based on what you're doing. And what kind of surgery you're having, what to expect after your surgery. This is a big one. As I'm sure you know, or maybe don't know, surgeons are busy. And so oftentimes it's not for a lack of want. It's just the time is not necessarily available to spend as much as they would really want with each of their patients. So what to expect after surgery is often one of those things where we just don't know, and discussion can really help for sure. Funding and insurance options. So, we'll dive into this kind of at the end of the webinar. Really, there's some things that are available to people, and understanding what to do and how to access those is really key. And so we'll help you navigate that. And of course, finally, ongoing support and resources. So how you can get the support that you need. It is by far not a one-day event. It is a journey, as you may know, from diagnosis through to beyond and living life again, and beyond surgeries and treatments and whatnot. So, it is not linear. It is up and down. Things change, and we need to allow for support for those moments in our journey. And they definitely will shift as we kind of make our way through. So firstly, we're going to talk about why post-surgical garments are different, why they're important. So some things that really differentiate what a post-surgical garment is. So I'm just going to dive into, what the main difference is between that and a sports bra. So a lot of times I'll get customers coming in and they've been told, just go out, grab a sports bra. If that was, the way forward, then we definitely wouldn't have post-surgical garments. They're there, not just to cover your wounds. They're there as a medical grade support. And what that means is that they have been tested in environments. They're tested for cleanliness, they're tested for functionality, they're tested to make sure that, the fabrics are sterile and, will encourage healing. So from that standpoint, when we're looking at comparing garments, a sports bra is great, but it is for activity. And really, when we're thinking about recovery, we're thinking about the opposite, really, of activity. We're not doing a vigorous exercise. We really want to allow for our bodies to heal. A sports garment, and I often say, if you're thinking about sports, like what are we doing? We are actually moving our body. So that sports bra, if you will, it's actually designed to kind of stabilize you and kind of has like a bit of bounce control. And there is some, heavy duty compression a lot of the time. And so we think compression, well, isn't that something that we like in a post-surgical garment? And compression, yes, but it is medical grade compression, which is very different than being compressed. So if we think about, say, like Spanx, a compression garment, compression hosiery, there's a purpose there is to kind of suck us in and kind of smooth our lines, and it's a bit more of a cosmetic thing, or whatnot. We definitely don't want that in our recovery realm. I often liken those type of products to, I would say, like if you're thinking about flossing your teeth, and you're tying that floss around your finger, which you probably know and you've done it before, you kind of essentially create almost like a tourniquet. And so what you're doing is you're actually impairing your body's ability to have that blood, or in a post-surgical setting, that lymph fluid to pass through freely, right? So when we think about sports bras, really what they're doing is actually kind of restricting that blood flow, that lymph flow. And those are things that we really, really need to aid in our healing after surgery. And when we think about the actual products, I'll turn the presentation off for just a minute, but when we think about the products themselves, we want to see things that are going to help with that. So soft, breathable fabrics that are not irritating. Again, they're medical grade, so they have been tested in an environment that will allow for your body to kind of heal and optimally, recover. So I'm just going to show you a few options, and we can talk about what exactly are these, why are they different. One of the main things when we're talking about a post-surgical garment is, well, firstly, the actual fabric. So it is very soft. I know you cannot feel it currently. I'm going to hold it up as close as I can to the camera just so you can see adequately. So we at Pink Ribbon actually sell a number of different post-op garments depending on what your surgery is. So when you go in and you are looking for your post-op garment, it's really important to, number one, talk about what kind of surgery you're having. Okay. Talk about if you've had treatment, what kind of treatment you maybe have had, because that can affect recovery as well. So if a radiated area of the chest is going to recover a little bit differently, right? So we want to make sure that we have all the information to ensure that you get the exact product that's going to help you. Now, one of the key things that you're not going to see in a sports bra, and you will see in a post-op compression bra, is we call it a long line. And so a long line is actually, pardon me, I'm just going to get my little lady here. A long line is where it sits on the torso, okay? And you can see that this band is actually quite a bit thicker, okay? You can't feel this material, I realize, but you can kind of see that it is relatively seamless, okay? We have seams, but they're right here. All right, the rest of the garment is seamless, okay? What you see here, this specific bra is called the Sina. It is a medium grade compression. And this one specifically, we have hook and eyes all the way up. Now, what you're looking at here, this is called a compression belt, okay? This would be used if you have reconstruction, and say you have implants, or you're getting under the muscle or over the muscle tissue expanders. There is a requirement for these expanders or implants to settle. They're going to take a little bit of time to fall into their place, and once that swelling goes down, this belt is going to actually help them stay in place and stabilize their positioning within the body, which is very important. We don't want a breast form to migrate. I have seen it before. I have actually had this happen to me where I did not wear the belt, and my implant migrated up. So I started to see that breast kind of mound was a lot higher than my other one, and they weren't the same. And I had a bilateral. So, even if you have both done, your body is going to react the way it reacts, regardless of the side of the body. So, and if you want, you can always help it to recover in a bit more of a targeted way, which is why we offer this belt. So kind of bouncing back to this bra, I'm going to take the belt off. So it is Velcro, and it just sits over top of the post-operative bra, and in the back there is a piece of Velcro that actually, it's for positioning. It's not, you're not going to actually feel it at all. But in the back of the post-surgical bra, there is a little soft area for the Velcro to adhere to. Okay, so like I had mentioned, this specific bra is called the Sina. It's a mid-grade compression. This you can see here. So when we're talking about compression, we're not talking about Spanx. We're not talking about compression garment like hosiery. We're talking about targeted compression. And why we want that is because when we're healing, we want to try to encourage that seroma fluid and lymph fluid for recovery purposes to move. We don't want to hold it in place. So again, a sports bra is not going to fit the bill. Sports bras typically have a much shorter line here. So you can see that under bust band is typically quite a bit narrower. The whole point is to kind of hold you in place, which is fine. This is not necessarily about lift, right? This is about structure, holding you in place, allowing for healing to take place. We want to make sure that your scars and your incisions are in fact cared for, okay? Often sports bras are moisture wicking, which is great, but they're actually not breathable. So a lot of these fabrics are breathable. They're ultra soft, antimicrobial, which is really important when you're trying to prevent infections. They do lay flat on the body. Okay, so as I mentioned previously, you're not seeing seams anywhere, which is really important. You don't want them to kind of rub on your incisions. That's going to be incredibly irritating. And we don't need to add anything to your recovery journey. Really, and I always say to all of my customers, is your job is to recover, right? So we want to help aid in that, and creating a situation where you have the proper garments for recovery is going to actually help you with that. We like to say that it's kind of like a medical hug, like it's just like a nice hug. This garment is not meant to be super tight. How we measure it is we take a measurement of your underbust, okay? So it's essentially, I don't want to say irrelevant, but it doesn't matter what size your breast is, in the sense that these are not cup based. So the actual breast area where the fabric is covering is very loose. It's there's no compression within that area. We are actually allowing for it to stretch for the recovery. And when you think about recovery, the first day after surgery is going to be a lot different than day 10, than day 14, than day 20. Okay, so something like this is actually going to allow you to move through recovery. Another thing that we are often thinking about is the cost implications of the products. The cost of cancer can be very high. So if you can get a garment, something like this, you know, this can see you through from beginning to like beyond. And so that can be a consideration versus buying something for each stage of your recovery journey, which is completely fine. And there are products for all that, but we always like to present the information that, hey, if you have some financial challenges, we completely understand. Something like this will take you through. So going to be really great right after surgery. This specific Sina is a hook and eye closure, and it has 2 levels of it. So you can start at the loosest, and as you are moving through that recovery, you can tighten it up, okay? And this is really going to provide almost like healing protection, right? So that hug, I can say just from my own experience, that I'll just put my lovely lady down to the side. That feeling of that product on you, it is like a hug. And so when I went through that journey, I definitely felt I don't know, you're going to want to, naturally your body is going to want to protect itself, right? So oftentimes we kind of cave into ourselves. It's protection, reaction. I have a little pillow here where when I would, like after my surgery, I would kind of put it here, like under my arm. It felt good, but it also was like a little shield for me, right? Which, sometimes even people still use it, and I think it's great, and it does help. But almost like having something that's comfortable and comforting on your body when it's recovering, it really does help. It helps with pain management. Like I said before, it's actually helping move that lymphatic fluid and that seroma fluid away. That's really what we want, away from the body. Okay, so I'll show you a couple of other products. Now, this one I think is Pamela. So this one specifically, Pamela, this is a stronger pressure, so a higher grade compression. Now, why does this matter? Well, based on the surgery that you have, your body will respond better to different levels of compression. So this one, when I say this is an Amona product, it's called the Pamela high compression. So there's different levels of compression. The under bust compression is 14 mmHg, which, I mean, broken down, it means milliliters of mercury. So it's basically a unit of pressure. And why this matters is, so say like a radical breast surgery, something that's really intense. Okay, so we've had a radical double mastectomy, you've had lymph nodes removed, also good for a breast reduction. So outside of, potential like actual mastectomy or lumpectomy surgeries, these are great for augmentations and plastic surgery as well. But this is going to help in a bit of a more, I don't want to say intense way, but it's going to do a better job of moving that fluid away and getting it through. So when we think of what the lymph system is, essentially what it is like a bunch of little pipes in our body. It's a very superficial system, meaning that it's very like close to the surface of our skin. Okay, so I think of them as like little pipes. They're moving things through, and our lymph nodes are actually our body's filters. So when we're thinking of recovering, we really want that lymph system to do its job. And when we've had surgery and we've had lymph nodes removed, which a lot of women do, that's kind of created a challenge for our body. So having a post-surgical or post-op garment is going to help our body move that fluid out so we can recover. Okay. So you can see here, now they're all the same, but based on the compression, and I know you can't really necessarily feel them. I'm just gonna, the lighting is potentially not the best, but you can kind of see the stitch shift right here. Okay, so we're looking at kind of behind the arm right here. There's no compression on the actual breast. Okay, it's really important to note that, because we don't really want that. Fluid will accumulate elsewhere, and we want to kind of help push that through. And again, we have some at the side here, so under bust right there. When we have our lymph nodes removed, they are typically at the side here and under our armpit. And again, this is quite a high line, so a long line, high line. So this is going to come up relatively high here. So we're looking for a greater area of coverage. When you look at the back, it's going to have quite a high back. Okay, so it's coming up pretty high. Again, lymph fluid can accumulate all over the place. It's a system that runs throughout our body, and so we want to do our very best to honor the recovery journey and help it out. Okay, so it's a high back. The other thing to note is that these are all very wide straps. Again, thinking about that little analogy I used previously, where we have that dental floss and we're creating a tourniquet. Another important note is that a regular bra isn't going to do it. So reason being is they typically have a much narrower or thinner strap, and that's going to create kind of like a barrier for that fluid. So we want to avoid that. And because we want that not to be an issue, we have a wide strap. So it's distributing that pressure. It's not keeping it in a specific place. The other thing that's really nice is these have Velcro adjustable straps. Okay. So again, when we're talking about recovery, it's a journey. And so day one, you may not want to wear this product, and that's a-okay. You'll be in the hospital. You maybe you're coming out the same day, you may come out the next day, you may be in for a few days. Everybody's kind of journey there is very different. But you will feel different. And I always remind my customers that, we see you on day 2, you're going to feel different on day 3, you're going to feel different on day 4. But rather than have a different product for every single day, you want something that can move through this journey with you. So day 1, we may want to have it a little looser. So we're going to change that strap to be a little bit higher. Okay. Allowing for this line to be a little lower. It's not quite as tight and compressive. You will have bandages. You will have your JP drains. So these can accommodate for that. And so you want to make sure that when you're actually wearing, when you're actually wearing these, listen to your body. Let the pain be your guide, okay? So if you're feeling a large amount of pain, loosen things up a bit, okay? The first bra, the Cena that I showed you, that's the highest, the mid-grade compression, and it does have the hook and eyes that you can adjust. This is the Pamela, so it's a much more compressive option. Done up is a different compression than not done up, okay? The other thing is when we're looking at this front closure, you're going to see that in all of the recovery garments. And the reason being is because our range of motion is almost non-existent at this time, right? We've had a huge blow to our system, and we need to try to find ways to help ourselves. So having a front closure is really going to help us with that. So we can put it on really easily. Even if you can't put your arm in, you can actually completely undo these shoulder straps and do the back, or have somebody help you with that. Okay, it's really these specific ones come in 3 different colors. So we have the white, the rose nude, and a black. Now, a lot of people will buy more than one if they can, because like I mentioned, they will start to wear them often. You can sleep in them, they'll wear them all day. Because it feels like a hug, you feel a little bit protected. So it's a really, sought after feeling, and you find that, okay, and it does help a little bit with pain management as well, which we love. Getting this on, it's gonna have a hook and eye, okay? So you'll always want to put that on first, okay? And once you do those hook and eyes up, it's gonna be a little bit easier for you to actually do the zipper up. Okay, so this one, the Pamela, comes with a little like dongle thing here, and then you can just zip it right up, and it comes with this coverage piece of fabric so that that zipper bit is not bugging you. Okay, so these are all super important components. Now, the really key thing to remember is, yes, there's different levels of compression. I'll show you some of the other ones as well. Because, say, the Pamela, which we just talked about, is better for like a radical mastectomy, that doesn't necessarily mean that you can't wear it for something less. We provide the guidance, you create the final product. So you're going to make the decision based on what's going to work best for you in your recovery. Okay. This one is a relatively new product. It's called the Patty. Okay, it's a black version, same idea. We have the long line. Again, it has the back Velcro, so you can wear that anatomical belt for keeping your breast implants in place. The thing that's nice about the Patty is actually it comes with the ability to have a drain pouch. So when you are going through your first week to 2 weeks, more often than not, depending on the type of surgery you have, lumpectomies, not so much, but if you are having an actual mastectomy, bilateral or unilateral, having this pouch is going to save you. And I'm telling you this from experience. These drains that come out of your body, their incisions are typically at the side of your breast. There's a long tube that's inserted in there. It has some holes, and the whole idea there is to pull that seroma fluid, right? So we're helping with drainage, and it looks like a little silicone grenade. Okay, so it's going to be coming out of your body, and it is, I want to say, like maybe 2 feet 2.5 feet long. When it's hanging out of your body, that can pose significant challenges for moving around. And so if you have something like this drain pouch, which is Velcro, so we can just take it right off. Again, when we're done with our drains, it allows us flexibility with the garment, so we're not repurchasing something. So this specific product can be Velcroed onto the garment, and your drain would sit in here. So that is going to just hold it stable in place so that you're not moving around and worrying about maybe your elbow catching that drain tube or it grabbing onto like the corner of a piece of furniture, something like that. If it's not flapping around, you're gold. And that's really where you want to be. You want to make sure that everything is contained. Okay. So this one, again, we have the adjustable straps with Velcro. You can really, dictate how you wear the product and where it sits on you, okay? So again, front closure zipper. This one right here, this is the Layla. This is the softest or the lightest compression. I would say more often than not, this is the one that women tend to go with. This is, again, the lightest compression, ideally for mastectomies, and bilateral or unilateral, completely fine. Again, the cup has no bearing on the size. We measure the underbust, okay, and we typically add. So if you're, say, a 36, we'd want you in a 38, potentially a 40. Reason being is our body is going to swell substantially after surgery. And so having something that's tight to start is actually not great. Even though it is a compression garment, we don't want it to be restricting blood flow and the lymphatic flow. And that's going to be the thing that helps us recover faster. So having a product that's too tight is not going to help you. So you want something that's definitely going to be okay when you start and you're swollen and as you kind of move down. So this one is actually quite a bit softer than the others. They're all the same fabrics, just the stitching is very different. And again, this is a front closure with the hook and eye. A little tip is if you do end up with a front closure zipper, the hook and eyes, you want to do them first. It is really challenging, especially when you don't have mobility and your strength is compromised, to pull these two sides together and actually get them to zip up. And so you want to utilize those hook and eye, so it's just going to make the zip up a lot easier. Another note, and this is definitely, it's not a need to, but it's a nice to know, is that a lot of nurses actually like a white compression product, just because if there's leakage, they can see it. So a lot of women, they might get embarrassed or like ashamed or shy about the fact that their compression garment has like some blood or some fluid leakage on it, and it's totally normal. It's actually really informative, and the nursing staff can actually see when they're helping you and caring for you or potentially changing your dressings. They can see that that's information for them. So if we have a black garment, it's a little bit harder. So often I will say, like, go for the white or a light colored option to start, because that's going to be the time when you're most likely leaking or you may have some blood or whatnot. And then if you want to have additional garments, you absolutely can down the line. So this one I'm going to show you. This one is called the Theraport. Now, a little bit different, okay? It is a post-surgical garment made for recovery. What you're going to see is actually the back line is very high, okay? Quite a bit higher than the other ones. I'm not holding it probably in a really conducive way for you to see it accurately, but it's a bit more of a racer back style. Still wide straps, still Velcro, okay? Allowing for, shifting, tightness of the straps. But what's really neat about this product is actually at the side, the Theraport, this specific material is stitched in a way that will allow for you to actually cut this, and it will not tear. The intention is to be cut so you can put the tube through. So really great if you're undergoing radiation or you have or a chemotherapy and you have the port in your tube. You want to kind of pull it out, or even your JP drain, you can actually cut that and pull it through. There's no right way to do this. When you're thinking about the other garments, they don't, and the tube will typically just come out from the side. It doesn't hurt. It's fine. Like, it's just holding it in place. And again, if you do have that pocket, that external pocket to hold the drain, it can be a part of this one, the TheraPort as well. It has the Velcro pieces there, so you can stick it on and use that too. But it's just a little additional functionality there. So if you are wearing your tubes for a little longer, it's kind of nice to have that ability. The front is not a zipper, it is Velcro, okay? It is really a soft Velcro. It's not like scratchy, like a high level of, like the weave is not high, so it's pretty low profile, so it's not going to be really scratchy. So this one's definitely one of the ones that we would recommend based on kind of what kind of surgery you're having. So when we think about beyond those first, say, like week, 2 weeks, when your drain comes out, other than the fact that it's probably going to feel like the greatest gift ever, the drain is the most cumbersome piece of recovery, and you don't feel when it comes out. I will say I did not feel that in every drain I had. I never felt it come out, which is remarkable because it's like a clown car. It just keeps coming. But I did not feel it, which is great. But when we talk about recovery, it is a journey. So if you are in a position to get other garments, we want to support that. So this one here, this one's called the Hannah. This is a very comfortable, breathable bra. This is high cotton content, which we like that for breathability. Okay, so we're starting to get into some details here. We got a cute little lace there. The straps are not adjustable, but they do have kind of like this plastic little latch that will put it in place. Again, kind of helping with that range of motion and putting it on. Front is we have the hook and eye right there. So we can actually close it off. Yeah, and I think, Jeannie, I see that you wrote that. It would have been so helpful. Really, I think that a lot of these things are, we don't really know about them. And so hopefully within this space, you'll get a bit of information. So for yourself or some to pass along to somebody else. All of these have a place in recovery. They are not essential. You do not need to have them have like a different one for every part of your recovery journey. The whole purpose here is just to make sure that you are wearing a post-surgical garment that works for you. It really will help. So when we get through that other part, our drains are out, we kind of want to start moving again. We can't do physical activity so much, like nothing vigorous. We're not swimming yet. We're not doing, a pump or a HIIT class or anything like that. But we want to start kind of moving forward and getting out of that bit more of like clunky, bigger post-surgical garment. You know what? A lot of women sleep in them. They wear them for months. It's completely fine. But other women, they want to get rid of it. Okay. So when we think about moving forward, something like this, which is called the Amelia. Again, it has a very high cotton content, so it's very breathable. It does have some unique stitching here. So when we think of the lymphatic system, what we really want to do is, and what we're thinking about is stimulating it. So it's going to be more on the surface, right? So it's not really heavy ridges. You're not going to really feel this, but it's there kind of helping. Now we're starting to get into adjustable straps. You can see the straps are narrower, so we're starting to become a little bit more narrow. We've no more drains. We can start functioning a bit more. The back is not as high as our post-surgical garment, so I would put this into the post-surgical recovery garment, like a comfort garment, versus a post-surgical recovery garment. So this one's the comfort garment. The other is the recovery. I'm getting myself mixed up. So again, zipper. Your still range of motion is going to be an issue for a little while. You have to walk before you run, so just be kind to yourself. This is going to be a really great option for that. And then moving forward again, so this is another product from Anita called the Lin Bra. We're looking at the profile, okay? The back is quite a bit narrower, okay? So it goes a lot lower down there. Some of the features, though, that are going to remain consistent is this waistband, or the underbust band, okay? So you can see that that line is a little bit longer, and we want that because, again, we don't want to impair the body's ability to recover and move that fluid. Even though our drains are out, we still need to continue that, especially if you've had a lymph node removed. Again, that body, its ability to kind of filter that fluid and move the lymph fluid through is impaired. So we want to encourage that. Once you develop lymphedema, and that's what we're trying to avoid, it is a non-reversible condition. So once you have it, we can kind of keep it monitored and keep it at, like a certain level. But if you don't necessarily, take care of that or preemptively try to work against it, it can creep up. And it does not happen to everybody, but like I said, when it does happen, you can't reverse it, which is definitely a challenge. It is painful. It definitely feels like swollen, tight, throbbing, like just pain. So we don't necessarily want that, this heaviness, and walk around every day. It's not enjoyable. So something else to note with these is all of the products, regardless of right after surgery, your post-surgical garment, all the way through to our comfort garments. Obviously, once you get out of this recovery realm, there are, a ton of other options available to you. But when we're talking about these post-surgical recovery garments, they actually, just like everything else, I'm just going to unzip this bra, is they all are pocketed, okay? So what that means is that it can hold a prosthetic. So something very important to note is that you should not be bearing weight on your chest for at least 9 weeks after, potentially longer. We need our body to recover, okay? But we often will provide a puff, we call it, and this has fiber fill, which you can adjust. Okay, we at Pink Ribbon give this to all of our new customers who are going through this, but what it allows for is you can stuff it into the pocket, okay? And so this is just, to provide you a bit of comfort when you're going out in the world, okay? So we know going out in your new body is sometimes a little jarring, and we're not, nobody expects you to be great with it. But it, in fact, something like this is not weight bearing. It's very light, okay, and it can sit in the pocket of all of the post-surgical bras. And so really easy to adjust. Sorry, I'm having some trouble because this actually has a modesty cup in it too, which is really nice, this specific one. So it's just giving you a bit more of a smooth line here, but you can remove the modesty cup. So when you're thinking about going out in the world, you don't need to be too worried. Even though you can't wear actual silicone prosthetic yet, there are options for you that are really light and that can be put into all of the post-surgical garments. So moving on from that, if anybody has any questions, I'll try to talk to them as well after. Okay. So choosing what's right for you, again, we kind of talked about this. You want to make sure the garment matches the surgery you're going to be having. So if you're having a lumpectomy, you're going to need something a little different than if you're having a radical mastectomy, okay? Consider your skin and your sensitivity. So if you are very sensitive, something with seams is not going to be your friend, okay? You want one of these garments that is really soft and breathable and is going to encourage healing in a way that is comfortable for you and not aggravating your skin, okay? Those seams sometimes can rub on the incision sites, and we don't want that. Comfort is key. Comfort has to be the guide. We don't want you to be uncomfortable. So if you are not feeling good, you're not going to recover well. It's also a state of mind, and if you're feeling really terrible, you're not going to move through the way you want to, and it could take longer, Okay. And again, as I mentioned previously, that your needs are going to evolve throughout your recovery period. So it's important that whatever garment that you do end up choosing, it is right for you, and what it be your economic challenge or whatever wherever you sit on that and that side of things, or if depending on if you're having a lumpectomy, or just depends on what kind of surgery you're having. Your recovery is going to evolve essentially. So we want to make sure that you're doing what's right for you and getting yourself to that point comfortably. So when we think about getting these products, I talked just kind of briefly about funding and insurance options. And again, a lot of times due to time, the surgeons aren't really able to share this information. So that's kind of where we come in. So the Ontario Assisted Devices Program, it's a provincial program, and when it comes to breast prosthetics, they will pay a portion of it. I've added the link in the presentation so you can see it. You can also search online Ontario ADP for breast prosthetics. They cover a pittance, I should say, not a lot. So we're always fighting to increase that coverage, as it's not really been changed since 2006, which is terrible. So for a full breast prosthetic, which every woman who has had breast surgery is 100% entitled to, while it is not 100% covered. So for breast prosthetics, it's $195 back per full form. For a partial form, now partial forms, if you've had a lumpectomy, you still qualify for a form. Imbalances will affect you. So we can talk about that in another webinar, but the imbalances of that these surgeries create will affect your posture, potentially pinch nerves, just mentally as well. So don't feel like you need to, be a hero. Get what you need to support your life and who you are, so you can feel as whole as possible and as comfortable as possible moving forward. Now, beyond the ADP and the government options, when you're talking to your healthcare provider, if you have private insurance, it's really important to discuss with them ahead of time if you can, if you have the opportunity. If you can't, it's totally fine. I know you're going to have a lot on your plate during this time. So I gave you a little tip there. So some terms to use, because as we know, insurance companies are large, and not every single person in the company maybe knows about different components of coverage. So we need to kind of help them along. So some terms to use are post-surgical garments, mastectomy bras, wound care. So again, if you're using something to aid in the healing of your scar, like our silicone patches, that would fall under wound care. And breast prosthetics, again, those are titled differently. They will be under different umbrellas of coverage. It's very important that you understand what you're asking for, because your post-surgical garment will fall under a different category than a mastectomy bra, which, if you do have coverage, often provides that coverage for specific mastectomy bras, which are pocketed, so beyond the recovery period from surgery. Okay, so those fall into different categories. So you want to make sure that you are asking for the coverage as it pertains to that. Okay, so that you can actually make sure that you get what specifically you're entitled to. A lot of people don't even use their insurance, which is wild. I can't remember the statistic, but I think, we pay into this coverage often with our employers. We're paying for it, and we just kind of like, it's okay, I'll take care of it, I'll cover it. But if you're paying into it, you deserve this. And so while us at Pink Ribbon Boutique, we can't actually direct bill, unfortunately. We kind of went down that route for a while, but it's really challenging to get proper coverage for our customers, but you can, and we can definitely help guide you. So if you have questions about what to ask. We can also provide quotes. So we can say, here's the post-surgical recovery garment. I want 2 of them. This is how much they will cost. You can submit that preemptively to your insurance provider, and then they know, and you can kind of move forward with that whole process. So we can help you navigate that. And if you ever have any questions surrounding that, we can do our best. We've contacted insurance companies on behalf of customers as well. So we do our best to kind of help you navigate that whole situation, because it is a bit of a challenge unto itself. So ongoing support and resources. So for us at Pink Ribbon, we're always available. You can always book a private fitting or a recovery session. It's very low pressure. We're not in the business to push you to buy something. We're in the business to help you recover and make sure that you are honoring that journey and getting the resources and help that you actually need. So we have a private room. All of our women are certified, trained, very empathetic and compassionate, and will sit with you and kind of work through that. You can book those on pinkribbonboutique.ca. You can always follow us on Instagram or Facebook. We're always putting little tidbits up and ways to help and different products that might help. And of course, if you have questions, you can always just call us and ask. And as I had mentioned previously in the chat window, I left my personal email up there. So if you do want to connect, please feel free. We are currently working on a great resource list of community and trusted community and hospital partners in and around the area. There are tons of resources. Just to name a few: Look Good, Feel Better. They are fantastic with supporting women through the kind of aesthetic journey that they're going on with cancer and all that it brings to you. So after chemotherapy, we're learning how to wig wear, we're learning how skincare changes. So all of those types of things are a fantastic resource. They often go to hospitals and do in-person sessions that are about 2 hours. You get a great goodie package. They're fantastic just to be a part of. Obviously, Canadian Cancer Society, they have tons of statistical data, but they also have a lot of information that will help carry you through and help you know kind of where to go. So it's like a decision tree, if you will. We work very closely with Markham Stouffville Hospital, but we also have a lot of connections with Southlake, Mackenzie Health, Princess Margaret, North York General, all of the hospitals in the GTA, and are constantly in and around looking for ways to support our community. So again, if you ever feel a little lost and you're trying to figure out where to go, please don't hesitate to reach out and connect with us. And I guess kind of wrapping up, I really appreciate you taking the time to be here with me today. I hope you found this session informative. We have just under 5 minutes. I see that my little webinar man is telling me to wrap it up. I guess they're going to be cutting me off at 5 minutes. So I do very much appreciate if you have any questions, feel free to put them in the question box there on the right, and I'm happy to answer. But if not, I look forward to potentially crossing paths in the future. I hope that you all are well and know that you're not alone in this journey, and there are tons of people here to help you or just help you find what information you need at the very, very least. It can be a lot going through this, and we're very aware of that. And I know myself in a different way, I'm aware of it just because of my own personal journey. But you don't have to go it alone, and there are supports available to you. So if you have any questions moving forward about the post-surgical recovery garments, please feel free to contact us at any time. But I really appreciate you giving me your time this afternoon, and I hope you found this very informative, everybody. So thank you so much, and be well and have a fantastic day. I'll stay here kind of quiet until it kicks me off. If you have any questions, feel free to toss them over. Thanks, everybody. Thanks, Jeannie. Thank you so much. It's so good to see your face or your name on there. Special place in my heart, and I look forward to seeing you at our new shop. We did just move, in case anybody doesn't know that. We're in a new location, 5873 Highway 7 East, so just west. I just have to get my bearings, west of 48 on Highway 7. Lots of parking, a lot better. Thank you so much, Anna. I look forward to seeing you both in the near future. I hope you're well. And thank you again for coming. I really appreciate it. It is quite an honor for me to serve you all, and I know all of my ladies feel the same way, so I appreciate your time being here. Thanks so much, Marion. Say hi to everybody at True Life. We love you guys. We didn't talk a lot about True Life today, but we'll get into vendors and whatnot that are some great supports for everybody moving forward. Some fantastic vendors, and you can also find those resources on our site as well. Alrighty, we'll leave it there. Thank you so much, everybody. Have a fantastic